Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the keys to sustaining the economy, but first, COVID-19 and Pennsylvania's hospitals. As they say, let's get to it.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, we have a number of important topics to take up. First of all, we're going to talk about aspects of the hospitals opening up, increasing patients. We'll see how that's all going. Sitting across from me is Andy Carter. He's the president of the Hospital and Healthsystem Association of Pennsylvania. Hey, thanks for coming on.
It's my pleasure. Thanks.
Now, I want to point out there's a plexiglass screen right between President Carter and myself. You like that, President Carter, don't you?
Brings back memories.
Yeah, we used to have a President Carter. Good. All right. COVID-19 is leaving lasting scars on Pennsylvania's hospitals.
It's really true. We brought in an independent set of experts to take a look at what's been happening to our hospitals. And here's what they found. A $5 billion financial hit because of the dramatic drop-off that was necessary, a drop-off on scheduled procedures. People had to stop coming to the hospitals for care. We were ordered by the Commonwealth, following guidance from the federal government, to shut down essentially everything except emergency care. So we're now looking at what that means long-term. That huge financial hole facing them presents real challenges for being able to sustain health care long-term.
Yeah. Well, essentially, you also have a lack of, how do I put it, the influx of patients. I mean, a lot of people are nervous, I guess, about going into a medical facility and put things off. Yeah,
it's time to get back for health care. There's no question about it. Again, let me give you an example. One of my members told me this, that in one 30-day period, they saw more ruptured colons in that 30 days than they had seen in the previous 10 years. And that's because people were failing to go in when they got some lower abdominal pain. They were afraid to go in and see their doctor. So we can't keep doing that. We need people to go in and get that preventive care, get those colon screenings, get the cancer screenings. We have to be on track.
But it's dangerous to your health if you don't get these. I mean, some of these treatments, or let's say you have symptoms, and you don't do anything about it when you would normally go to a physician and maybe get referred to a hospital, except for emergency care, obviously. I mean, it's absolutely dangerous to somebody's health.
Absolutely. And on the other side of the coin, it's safe now to go into hospitals for care.
Yeah.
They have taken a huge number of precautions, just like the kind you're put in place here at your studio.
Plexiglass screen.
Plexiglass separating intake staff from patients. Distancing within waiting rooms. In fact, people aren't even being told to come into waiting rooms until their time is set.
Yeah, that's true. That's a good point.
Lots of disinfection going on. It is safe to return for health care. And it's really important to maintain everything about our health.
Well, when I don't want to personalize it, but when I've been very comfortable going into physicians for a whole variety of things, and the care that they go through and the cautious nature of how they deal with you, I didn't have any concern. Now, I washed my hands probably 5 times once I left and used hand sanitizer, which we're supposed to do. But yeah, and I think people in the healthcare fields are doubling down on being safe.
For 2 reasons. One, to take care of you, but of course they want to take care of themselves first. And I should pause and just express a debt of gratitude to all these frontline healthcare workers, physicians, nurses, respiratory therapists. They're at grave risk. That's why we as hospitals work very hard to make sure they have enough protective equipment and that every office and care setting has all the protections in place.
Yeah. But you can't do what they do in hospitals because that's where you're the expert in. You can't, you still have to be concerned if you're a healthcare worker in a facility. I mean, it's hard to avoid, some people are asymptomatic, and I know they do they do the temperature screening and have a whole bunch of questions that they they ask you, before they let you move beyond the hallway into the offices.
And screening is key, and a lot of hospitals are put in place to the degree testing capacity is available. They're testing patients for COVID-19 before scheduling them for procedures, for example. So testing is important to help fight and continue to flatten the curve. And people should, though, be confident that they can get safe care.
All right, we're going to run to a break. When we come back, we're going to talk about what to know when returning to a hospital, and we'll get to that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
I'm chatting with Andy Carter. He's the president of the Hospital and Health Systems Association of Pennsylvania. Hey, before we get into this topic of you're going to come back to the hospital or go to the hospital for the first time and what you should know and what you should do, but there's also the situation with the finances of the hospitals. And the fact of the matter is that lots of organizations and businesses have gotten some relief, federal stimulus packages and some from state governments as well. So what's the prospects for the hospitals in the state getting some kind of either federal and or state aid?
Well, that relief is critical, and hospitals have received important federal support so far. However, it hasn't been close to enough to replace the enormous losses that they have sustained. So we're asking for the governor and the General Assembly to take what's left of federal money available to the state to allocate to those who've incurred losses, to set aside a substantial amount to help hospitals close the gap further. And so we estimate that's at least another $1 billion or $2 billion that would be important to have a conversation
And that
about.
money is currently available.
There's about $1 billion available to the General Assembly and the administration.
And that's federal government money that came to the states.
That's correct. And it's available to help offset the costs of COVID-19 response. And we are clearly an important part of that COVID-19 response.
Right.
We took all the steps we needed to take to be sure we were open and available to see these thousands of patients that have needed our care. So now it's time to help make sure that that financial loss is at least partially offset, and we still have a way to go. We're grateful for the help that we've received so far, but we need to finish the job.
It's prediction time.
Yeah.
What are the prospects for getting the money?
Well, we're in intense conversations with the administration and the General Assembly. Obviously, they have an enormous set of challenges facing them. But we know that everybody wants to have a dynamic and strong healthcare delivery system, and hospitals are the cornerstone of that. You know, we do everything from, of course, provide patient care, but we train tomorrow's physicians and nurses.
Oh, yeah.
And we conduct lots of research. In fact, our members are working hard on everything from vaccine research to other biologic treatments and preventive strategies for defeating COVID-19. UPMC and University of Pittsburgh just announced progress on something called AB8, I think it's called.
Yeah.
It's an important potential breakthrough. We have to support these hospitals and academic medical centers, both financially and, of course, with all our moral support as well.
All right, on the subject that I promoted, you're either returning to a hospital or you're going there for the first time, and there are things that you need to know before you do that. Well, what are they?
Well, first know that these settings are going to look different than perhaps the last time you were there. You're going to see such things as these kinds of plexiglass panels. You're going to be asked to wait in your car in many cases. And when you enter the hospital or your physician's office, you're going to find that many waiting room seats have been removed, or they have tape across them so that you maintain social distance. They'll ask you, they will insist, they will require you to wear a mask as you move through the facility. And it's all designed to keep you safe, but also to keep these frontline healthcare workers safe. You'll be asked, I know you do, Terry, you'll be asked to wash your hands frequently or use sanitizers.
You mean like 10 times a day?
You really can't wash your hands too often.
I know.
And I think you'll find that caregivers will be wearing face masks themselves. They'll often be wearing shields over their faces to protect them. So just be prepared for that, not surprised, particularly if you're taking children to see a pediatrician.
Sure.
Children have to get a little bit of education up front that things will look different.
Sure. Do hospital employees have enough protective equipment? Are you still getting requests for it, or has it basically been satisfied?
Right now, supplies are about where they need to be for the volume of patients that are presenting at hospitals and doctors' offices today. However, we do worry that if there's an upsurge in COVID-19 combined with the seasonal flu, supplies of PPE, we call it protective personal equipment, could be sorely stretched. So we want to work with the Commonwealth and the business community to do all we can to resupply the supply line.
All right, well, thanks for the update. All right, coming up, keys to sustaining the economy. We're talking about health care and we're talking about the economy, and they're interrelated. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
All right, what does it take to open up Pennsylvania's economy? Joining me is Dave Taylor. He's the president of the Pennsylvania Manufacturers Association and a frequent guest on the program. All right, David, well, let's start with the economy. There's this big debate about how quickly it should open, as you know. Can it be open safely? Lots of restaurants and salons and bars and taverns, they're not going to survive this. And, they want to open up, and there's a big debate over it. So what are the principal factors, as you see them, in opening up the economy and doing it safely?
Well, the employers need predictability, and that's the element that's been most critically absent in the course of the pandemic response. We need assurances that there will not be another shutdown. Of course, the governor's shutdown order was just rendered unconstitutional by the federal court in the Western District. We need assurances that there will not be another shutdown. We need the Commonwealth, if there is a second wave of infection, we need the Commonwealth to recognize the federal guidelines under the U.S. Department of Homeland Security as being definitive. Those are clear as to what is an essential industry, and it recognizes the contributions of supply chains and critical vendors. And so our failure to adopt that previously was a major mistake. I think there also needs to be a recognition that we need the economy to be open, and that insofar, like the degree to which businesses can be open safely, we need them to be open so that they can have a lifeline of revenue from satisfying customers, because, Terry, those decisions are being made right now as to whether a business is going to choose to try to keep going or whether people are just going to quit. Another element that's a key part of that decision-making process for those businesses right now is the danger of frivolous lawsuits. And so this is why we need, the governor could do it by executive order, the legislature could pass a law. We need to have safeguards, safe harbor for those businesses that are abiding by the CDC guidelines, that they put up the plexiglass and there's social distancing.
You mean like what we have between us?
As I'm looking at you through the plexiglass, for those businesses that are doing that to protect their employees and customers, and that they can prove that they're doing that, that should be safe harbor from frivolous lawsuits. Because, again, I'm very concerned about the litigation industry and what they are looking to do to plunder the economy because of the pandemic.
Well, has there been an increase in the demand for products produced by the manufacturing sector in our economy in the last couple of weeks? It looks like the economy, in some respects, is opening up. You see more cars. You see more people going out, not just eating, purchasing.
I mean, I do believe that the economy is coming back to life, but it's slow and it's unsteady. We're still, we're trying to get the sand out of the gears from the governor's unconstitutional shutdown order, and that what that did to knock out different sectors and to cut people off from their suppliers and distributors.
All right, look, we're going to run to a break. There are a couple of other important topics that we want to talk about. Maybe we get a little more into detail about Governor Wolf, and he's promised to appeal that situation, but you can get into it a little more in detail. We'll be back.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
Well, we're going to talk about the governor's, the court case involving the governor for some of the actions that he took when he was, obviously while he serves as governor. And we're working on getting Governor Wolf on the program. He's been on before. We'll be delighted to have him on, and we hope to get him on soon and get his point of view and positions on a whole variety of subjects. All right, David, so tell the folks what this court case was about, and what did the governor do by executive decree? I think that's the best way to put it.
Yes.
That brought this all about.
Yeah, under the governor's emergency powers from the disaster declaration, that, as the public well knows, the governor did quite a number of things in terms of restricting the ability of businesses to function, the ability of people to gather and to travel, and then also subsequent to the business shutdown order, the ad hoc waiver process that he put in place internally through his office, that a group of counties from Western Pennsylvania got together and sued the governor in federal court. And the Western District Judge, Judge Stickman, handed down a ruling declaring the governor's actions on those counts to be unconstitutional. So, I have to say I'm very disappointed in the governor's response to the ruling, that he was very defiant, said that he is not going to obey the federal court, that he's going to appeal the ruling. And of course, then we'll see how quickly the Third Circuit takes up the governor's appeal. But the judge's ruling was really quite sweeping and very stern in the smackdown that it gave the administration. And I regret that the governor seems in no way humbled by the very serious beating that he took in that ruling. That there should be a recognition on his part that that there are checks and balances, that there are multiple branches of government, and the multiple layers of government, state, federal, and local. And again, the governor's response to this is very unsettling. And so we'll see how this proceeds, but it certainly does liberate Pennsylvanians to reclaim their constitutional rights to freedom of speech, freedom of assembly, and the ability to earn a living. But much of the damage, Terry, has already been done. That the arbitrary nature of the governor's shutdown order, and this is something that the judge spoke to, instead of following the federal guidelines that recognize critical industries and the things that are the things those industries depend on, that the governor came up with his own ad hoc system of just choosing what could be open and what had to be closed. And again, there's no justification for what he did, and beyond that he exceeded his powers and infringed on the constitutional rights of the people.
Okay. What's the business waiver rule, and why should folks out there care about it?
Well, so one of the things that was most unsettling about the way the governor handled the pandemic in ordering this broad business closure order, that everything was ordered closed until it had explicit permission to be open, and then when people whose businesses were essential were ordered closed, that they had to go through this waiver process. The waiver process was unclear. That even now, to this very moment, that we don't know who was denied a waiver, what criteria were used, or which individuals in the governor's office made the decisions that shut down people's businesses. And so the governor has shrugged off subpoenas from the state legislature. And Terry, I'm not a lawyer, but I never thought that subpoenas were optional. And then we had a promise by the Auditor General, Eugene DePasquale, that he was going to audit the governor's waiver program. He made this promise back in April, and that there has been no report. In the interim, Mr. DePasquale, who's running for another office now, that he has received campaign contributions from the governor, that the governor has headlined other fundraising events and otherwise mobilized political support for the Auditor General and his candidacy. And so I have to say, Terry, that the business community has lost faith in the Auditor General's ability to conduct this audit without bias, and so that's why we're asking him to recuse himself, to stand down and just to allow his professional staff to complete that audit and expedite it, because, I mean, quite frankly, it looks like a stall.
Yeah. Well, the fact of the matter, and your argument is that this has had a serious effect on the economy of the state.
Oh, it's been crippling. And that there are businesses that, because they were ordered closed, and that they were closed for many months, that they've gone under. And again, just to give one example, I'm from Huntington County, and that in Mount Union, PA, that there's a cabinet-making company called ACPI. They announced that they're going to close. They were shut down for months. And that's more than 200 jobs, Terry, in a small town in a rural county, and that is a deep and grievous wound to life, for that community, for those people. And that during that same process, that somehow Wolf Home Products in York, the governor's family business, that they did receive a waiver. And so, these issues have been outstanding for months, that people have lost their livelihoods. And for many of these small businesses, you got to remember that business isn't just a person's job, it's their life's work and their retirement plan. So for these things to be destroyed, and in light of the federal court's ruling, I would think that those business owners would have standing to file a suit against the Commonwealth as an unconstitutional taking.
Yeah, and I think it's a very complicated issue. It has a whole bunch of points of view, and as I said, we'd like to have the governor come on and explain his points of view, which we try to do on this program routinely, regularly, and we're always glad to have your point of view. Thanks for coming on. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, you stay well.